Tonight, the Obama administration working feverishly to set the record straight on what it calls myths about government-led health care. As Inez Ferre reports, however, the president insisting the insured will be able to keep their plans and their doctors just might not be the case.
It's come up in a number of town hall meetings on health care. The concern that if given the choice between a government plan and a private plan, many employers would choose a federal one, assuming it's less expensive. President Obama and Democrats have gone through great pains to reassure Americans they can keep seeing their doctor.
If you like your health care plan, you can keep your health care plan. This is not some government takeover. If you like your doctor, you can keep seeing your doctor.
Not true for everyone, says factcheck.org. Under the House bill, some employers may have to modify plans after a 5-year grace period if they don't meet minimum benefit standards. Also, some employers are likely to buy different coverage for their workers or drop coverage and pay a penalty instead, in which case workers would have to buy their own private insurance or go on a federal plan. The factcheck.org analysis describes the legislation as a moving target with projections of how many would switch to federal plans ranging from near zero to as much as 56% of all covered workers. Peter Pitts worked for the FDA during the Bush administration.
You may not be able to keep the plan that you've got because that plan may cease to exist. You may not be able to go see the doctor that you've always seen because your insurance plan may have changed. So when the president says, definitely, you can keep your doctor, when members of Congress say, definitely, you can keep your insurance plan, they're just guessing.
Then there's the issue of who doesn't have insurance. 46 million uninsured in the U.S. is the number you generally hear. That's the number of people who told the government that they didn't have insurance at some point during 2007. According to a research institute run by former health insurance industry executives, that includes at least 12 million who are eligible for public health insurance programs, but for whatever reason don't participate. Of the 10 million non-citizens lacking health insurance that year, more than half are estimated to be illegal. And some 7 million uninsured individuals, many of them young adults who earn at least $40,000 and may have chosen to skip health insurance because they thought they didn't need it. And one healthcare think tank that we spoke with asks if the actual number of uninsured Americans is far less than 46 million, is there a better way to devise a plan that would do just that, cover those uninsured people without potentially affecting the rest of the insured population? Lou?
A lot of good questions asked and so few answered in this debate so far. Perhaps that will begin to change. Inez, thank you very much. Inez Ferre.